Welcome to the CanaCard Patient Management System. End-to-end technology solutions providing safe access to medicinal marijuana treatment in Canada.
Well, ladies and gentlemen, welcome. We're so pleased that you come to see us today. We're pleased to present the Physicians Medical Cannabis Seminar, focusing on seniors in chronic pain. Our team's going to get together and we will formulate the social conscience of this company, and you'll see that as we evolve. We really believe that we've got a very specialized software, with something like this that's so controversial. The seriousness is that it needs to be regulated, and all of these governing bodies that have been a part of our health system and patient care for all of these years needs to be satisfied. And it's been a very difficult thing to design and do. If you just, from the medical side, of course, the e-health program that our country tried to put together, even after all that money, it was very difficult to get it right. Well, we think that the CanaCard system, the patient management system, has got this figured out. We believe that we've created a system that's really great for the patient and really great for the doctor. And it should satisfy all of the people that are involved. The nice thing about this for you doctors is that it's in real time. So when you see a patient through the process that needs to be approved by all of the levels of government and societies and insurance companies, what happens is when you see the patient, all of the data would be stored in our system. Actually, the clinical response for the prescriptions are in our system. And the nice thing about it, because it's in real time, all the billing happens immediately. So doctors now are not faced with this challenge of billing later and after. It all happens as a part of the system. But I'm not a doctor and I'm not a technical guy, but we'd be happy to show you how this works if you'd like to arrange for a presentation at your office or with us later, whatever it takes. We'd like to be friends with you and show you how we can really change the world here. And as Canadians, we enjoy making a difference. That's how Canada's been. It's always been there first to help. And as far as the world is concerned, this approval for licensing the medical marijuana in our country and the grows and this challenge of bringing this to the forefront so that it does satisfy all of the people involved in this medical advancement of some help, some healing, some alternate medicine. This focus that we have tonight on seniors and chronic pain, I think we can make a dramatic difference for the seniors in our country. And I think that we can show the world that we can create a system whereby the medical profession can all work together to really make a difference. Our first speaker is Dr. Jameson Feramisco. Dr. Feramisco is an MD and a PhD. He is a practicing physician who focuses on internal medicine, dermatology, and wound care. I'm really thrilled to be able to tell you that he is the Chief Medical Officer for Alternate Health USA. And without further ado, ladies and gentlemen, would you please welcome Dr. Jameson Feramisco.
Thank you, Bobby, for that really kind introduction. I appreciate it. It's an honor to be here. I want to talk to you a little bit about big data and how data really can affect medical care and how we can make a difference by utilizing data and understanding technology and how that can apply to medicine. So a few comments about my background. So I'm trained in internal medicine and dermatology and hold practice as a hospitalist and a dermatologist in wound care. And I take care of a lot of seniors. And I see a lot of seniors in the home, seniors in nursing homes and in different environments, and understand all of the different stages they go through in terms of how to take care of them and what can go wrong and how to take care of pain in the senior environment. As Bobby mentioned, I'm part of the Alternate Health Group as well. I've been working in various startups in the Bay Area for about 5 or 10 years or so, and have done quite a few startups in telemedicine. And so for some crazy reason, I decided to take call. I took call for 3 or 4 years straight at about 5 nights a week. So doing telemedicine. So I've done thousands of consults to understand how to deliver care remotely in a safe fashion. And that's going to be an important part of what I want to talk about and think about how we can deliver care, how we can scale care as well. I've been involved also in a lot of clinical decision tools, understanding how to use data, how to use technology, how to use computer-assisted learning to help diagnose patients and to help use those diagnoses to help scale the delivery of care as well. Also, I think medical devices. Medical devices are fascinating. The wearable industry, we'll talk about that. There's all sorts of amazing things going on now in the world. How many of you have a wearable today? Not many, not any. A couple, right. So in 2 or 3 years, we're going to have, everyone will raise their hand probably, and it's going to be passive. So the phone that's in my pocket here is going to passively collect my data, and it's going to transmit that somewhere to a clearinghouse that's going to be reviewed by a computer and then by nurses or physicians. And that's an interesting and fascinating vision that's going to happen pretty soon. The computing power that's housed in a smartphone right now is about 5 times greater than the computing power that was in the original big supercomputers that were in these big rooms that needed lots of air conditioners to operate. And that's really, we're able to leverage that to some degree now. So it's going to be interesting what happens in the future. So, big data. In 2 days, every 2 days that exist now, we generate as much data as we did from the history of the world up until 2003. That's an amazing statistic. Every 2 days we generate that much information, that much data in the world. So this is in all sorts of sources. This is in medicine. This is also Facebook, LinkedIn, Amazon, Google, all these big companies that we hear about coming out of Silicon Valley. They all generate massive amounts of data. And as you know, a lot of them are now turning to healthcare. So the Apple Health Kit's been released. Google is now going back into healthcare. All of these companies are really looking to healthcare and looking to data for the future. Data, I'm a big geek here. I like to think of data as having characteristics. So data's got characteristics of volume, velocity, and variability. So data's, it's an abstract concept, but it has characteristics to it, which are very important. It's not just the volume or the velocity, but the density of information. Now, what's really fascinating is that healthcare data and big data in healthcare is very information dense. So you can imagine the information that's housed in a human genome, information that's housed in a patient's medical record. All of that is very dense information. There's a lot of fact behind that. So to understand what to do with all that data is pretty complex. And so, do we really know what big data means? It's a term that's being thrown out there. You guys have probably hear big data is always being talked about, but what exactly does it mean? What can we do with it? It turns out that looking at patient data, most of the data is this structured data, which is kind of like laboratory findings, imaging, information about the patient. So the things that we, as physicians, what we look at for day-to-day to help make clinical decisions. That's 80% of the data. What that turns out is these big numbers, these terabyte type numbers. So if you take a population of patients, it's going to be, to house the data for that patient is in terabytes. So it's going to take, now we're back to what it was in the 80s with needing those big, huge rooms of storage. Now, it's not for computing power, it's for storage of information now. So we're shifting over for the computing power being a commodity almost, and now the storage of information is essential. So what we've done is we've taken highly dense information in healthcare, and now we have to figure out what to do with it. How do we affect change with that dense information? We're starting to see trends of sort of datafication of health, if you will. And so there's a law in physics called Moore's Law that shows that the rate of information is doubling every 2 years. In healthcare, it's doubling every 6 months. And that's on top of remember the statistic that I said that in 2 days we have more data than that was existed prior to 2003. So things are doubling very quickly. I kind of think this is an interesting little infographic. Human genome sequencing down to a few $100s. The sensor industry, I mentioned how many people have sensors, wearables. That industry is growing very big. Every minute, there's all sorts of data being uploaded. How many of you have uploaded something to YouTube in the past month? quite a few of you. So you guys contribute to this every minute. There's 48 megabytes of information uploaded. So what I think, we're seeing is that big data really presents an opportunity for transformational care in medicine and also transformational care in medical cannabis. So we're seeing trends in digital healthcare funding. So funding is going to be a part of innovation. So what we're thinking is that we see that there's a big opportunity for funding in the medical cannabis market to really help drive innovation. And that's what we're looking for in the future, and we're predicting that to happen. What we're seeing also is unusual suspects coming into play for healthcare. So retail stores. In the United States, a lot of Walgreens, CVS, Walmart, all the retail stores are now getting into healthcare with the pharmacy space. Insurance providers and payers are changing their tune. Government, large corporation, community hospitals, and academic centers. And also they're thinking about medical cannabis. It's a hot topic all over the place. The comfort zone is data rich, so all this information, but we're really protocol poor. We're really insight poor. What we want to get to is a personalized medicine. And so what that means is understanding how we can personalize the care of a patient based upon their medical history and their needs for treatment. Kind of the world in general is looking for hyper-personalization. So I don't know if you've noticed, but on Google now, there's the predictive searches are coming out. So the goal for Google is to really understand what you're going to type into Google before you know what you're going to type in. So that's the next generation of hyper-personalization of care for the retail market. Now we want to get there in the medical market too. We can't do this with small steps. You really have to take a leap and then build the scaffold back for everyone else to come and follow. So Google did this, Facebook did this, looking at the world as intertwisted graphs. We're doing this in medicine. So this is the graph of medicine. It's kind of an interesting concept to put all of medicine together in a three-dimensional or four-dimensional graph, if you will, that relates signs and symptoms, disease states, lab values, genomic data, everything together in an intertwisted three-dimensional web. What we can do with that is really understand how to best treat a patient. So think about a person with chest pain. If the person's an 18-year-old young boy or young man, their graph looks like this. If they're a 60-year-old gentleman, their graph looks different. So the differential diagnosis, the cause of chest pain in an 18-year-old is different than in a 60-year-old, right? We all know that that's most likely different. In the graph of medicine, we can see there's a difference, and we can use that to help predict outcomes, help predict tests, help predict what's going to happen to the patient. So what we really want to do is understand how to do this using the cannabis, making a medical graph of cannabis, if you will. So as you're all well aware, Health Canada changing landscape as of April 1st for the legal source of marijuana for medical purposes will be under the LPs, under the licensed producers, right? So now there's kind of a really formal chain of production, chain of distribution as well. And there's this big manual that I had the pleasure of reading, Information for Healthcare Professionals. Big, long book. I don't know, how many of you have read that manual? Yeah. How many of you stayed awake for the whole thing? So what's interesting is how do we really leverage the data that's out there? There's some debate right now, as of just a couple days ago, a statement by the Canadian Family Physician Association said that there's not much information, not much data behind the use of medical cannabis. And so these are some studies that, there are studies out there, but there's not that many. And this is something that we're all looking to do together, I think. We're aware, this is Dr. Lemire sent out a notice saying that basically physicians are in a difficult position. So physicians who prescribe medical marijuana are in a difficult position in Canada right now. And the reason being is that they're basically saying they acknowledge there's a lack of evidence and solid evidence, but there's also the right to prescribe, and there are certain conditions that do warrant prescription. And so, for instance, he was talking about back pain and fibromyalgia, however, also opening up the possibility to talk about multiple sclerosis, cancer, shingles, neuropathy, and injuries as well. So there's a landscape that's confusing for us as physicians here. So the question is, what do we do about this? As physicians and really as patient advocates, what do we do? And really the answer is we want to go back to the roots of data and put things together here and really look at things like clinical trials, hyper-personalization. So hyper-personalization is a funny word, but it's sort of like, how many people have searched on WebMD for something? If you type in fever and headache, it says you either have a brain tumor or you have a common cold, right? So that's medicine. Personalized medicine is when you type in fever, headache, in a diabetic who has a hemoglobin A1C that's a little bit elevated. Now you get a more specific answer. Hyper-personalized medicine is where you type in fever, headache, diabetic, A1C of 10, they're wearable and that's in their pocket, says that their vital signs are heart rate of 120, blood pressure 90/60. Now you really know, you're getting granular. And now you know if you add the genomic data and you add that the patient is on medical cannabis, is using other medications, being prescribed other medications, has not taken their prescriptions in 3 or 4 days. Now you really drill down to hyper-personalization. That's where we want to be. We want to really understand regulation. We want to embrace regulation. I never thought I'd actually be saying that, right? To want to embrace regulation. But that's an important part of this, is to understand regulation, embrace it, and really design a system that works well in the system. So transparency, security, data security, standardization of the security, analytics, and of course increasing the knowledge base. Right? So we want to create together a graph of medical cannabis that's analogous to the graph of medicine. So how many of you guys have a credit card? All right, everyone. How many can look almost in real time online to see your purchases? Almost everyone, right? How many of you have had labs or seen a doctor in the past year? Probably most people. And how many can go on the internet to see the results or the notes in real time? Nobody, right? So why is that? Some people can, but most people can't. And in the United States, almost nobody can. There's a few systems now that are doing this, but it's certainly not as rampant as credit card. Why is that? That's really not the way we want to be. And really, how many of you know the true cost of services? Nobody knows that. That's a huge debate. So what we want to do is we want to start and really build the right standard from medical cannabis. So we have an opportunity to build the marketplace, and do it the right way. So one solution that we think is a pretty solid one is the CanaCard system that's been developed. And this is a way to really reinvent the standard of care, really start the standard of care for medical cannabis. So what this system really does is it connects the patient through a HIPAA-compliant, secure cloud with the licensed provider and with the doctor through intermediary servers that are all secure. So it's a circular link between the provider, the LP, the doctor, and then a server. And it allows for transparency of records, transparency of regulation, and transparency of all the things that we really want to have and need to have in a medical system. Some things that we can do from the doctor side is we have a nice dashboard to really look, again, transparency of what type of encounters, what type of activities have gone on from the patient side. How do we link those up? So this is really essential. We also have the ability to view prescriptions. When were they filled? What was the dose? How much was filled? What's left on the prescription? We also have the ability to look at the patient profile and actually have the prescription linked to the LP, and there's linkage directly to the LP that they can look and figure out which strain is right for the patient. Now, right now we don't have good clinical trials, but in the future, the holy grail is to link patient hyper-personalization with clinical trials, with genomic data, with history of present illness, with signs and symptoms. All of that linked together, that's the vision, that's possible. That's where we want to be. We really want to be the centerpiece of resource utilization, improved patient outcomes and harm reduction, and then population and individual health metrics. That's really the key. So I just want to go through really quick. I know I'm running low on time. I want to keep you guys awake. But I want to go through a couple of technology and medicine, some really cool things that I think you might find interesting of what's going on and how they relate together. A company called Scanadu. You guys know Star Trek and the tricorder, the medical tricorder of Star Trek? This is the vision of this company, is to build a device, list in the bottom right, bottom left here, that you hold it on your forehead, basically, and what it does is measures your vital signs in 5 seconds. So you can measure all of your vital signs almost instantaneously just with touch. It also can measure an EKG, so a heart tracing as well. So this is a fabulous device. It's in production. It's going to be released pretty soon. So I was part of the team that developed that. This is a fascinating advance in medical science here. Another one called a LiveCore is a device that's able to get an actual EKG on your smartphone, on your iPhone. So you put a sensor on your heart, and through your iPhone you can get really an EKG tracing. Fascinating. So as we all love our animals, right? The first application that was tried was dogs and cats. And so you get EKGs on your household pet. It's kind of a funny thing that's around. There's another. This is a fascinating company that really uses the combination of smartphone technology and social media. So this company and others like it. There's 4 or 5 others, but they go through your social media data. It's a little scary, but it's interesting. Okay. And they say, okay, well, normally Bobby tweets 100 times a day, okay, but now he's only tweeting 10 times today, and so he normally changes his Facebook status 3 or 4 times a day, but now he hasn't changed it yet, so it sort of goes through the algorithms and predicts that Bobby is probably not feeling well today, so someone's going to give him a call and ask him how he's doing because his social media patterns have changed, so these are looking at social cues, really getting hyper-personal and linking that to healthcare data. So that's also kind of this part of this end holy grail is to understand how the links of social media, healthcare data, sensors, and big data come together. Okay, so that's something that's we're learning more about this. Another company that we're part of is Transfuse Solutions. What we look at is blood management. Now in Canada, you guys are really good at blood management compared to the rest of the world and certainly compared to the United States. This is a graph that's kind of interesting. So if you go in hospitals in the United States, if you go in for a heart bypass, a CABG, coronary artery bypass surgery, if you go to hospital A, you have a 5% chance of getting a blood transfusion. That's pretty good. But if you go to hospital Z, you have a 90% chance of getting a transfusion for the same procedure, for the same comorbidities subtracted out. It's called clinical variation. So that's something that we need to reduce. Or right. Yeah. So it's the clinical variation is huge. So we need to really use evidence. And so this is a company that we look to use evidence and data to really help affect clinical change and help patient outcomes. So there's an opportunity here with the CanaCard platform to gather all that data and use it to affect solid clinical change. Apps can be a big part, mobile apps can be a big part of the decision process for understanding how to treat patients. Telemedicine, the remote delivery of healthcare. So this was from 1920 or so. So there's a radio doctor, right? So the idea of having a doctor in your home was proposed in the 20s, so 100 years ago, and it still is just now taking off. Ontario Telemedicine Network is probably the world's leading network for telemedicine. There's some in the States as well that are decent. The technology looks like a robot. So this robot can be remotely controlled from a third-party computer. The doctor can drive it around the hospital. It's pretty cool. This is basically a suitcase that can go in an EMT in an ambulance, take care of patients remotely, and then we have iPads now. There's peripherals. You can get weights, blood pressure. You can use that Scanadu device to get vital signs. So this is something that I wanted to show, the ability to link up telemedicine with the CanaCard. And so this is the Google Glass. So this is a live, active telemedicine platform. So we're doing this right now in strokes. So we have ER providers wearing the Google Glass and neurologists on the other end who are basically seeing the patient live with audio, with video, with vital signs and all the data being transmitted through glass and allowing for live streaming telemedicine. So we think there's a really big opportunity to combine the standard of care with medical cannabis using telemedicine. And Google Glass is probably a reasonable way to do this using the system. Finally, one thing I always think about no matter what when we're using technologies and as a physician is really first do no harm and then to do good for our patients. So that's a really essential concept that we have to always think about when dealing with our patients. So I really thank you guys for your time. Thank you for your patience. Appreciate it.
He is an innovator and a man with a vision. We're very pleased that he has consented to be our Chief Medical Officer for Alternate Health Canada. It gives me great pleasure to introduce to you Dr. Peter Ferguson.
So I was asked to give a little bit of perspective from Canadian physician point of view. So I'll tell you a little bit about what I do. I'm an orthopedic oncologist, and when I say that, people's eyes usually glaze over and they say, what the heck is an orthopedic oncologist? So I'm an orthopedic surgeon, and I deal with people who have bone tumors, primary tumors, metastatic tumors in the bone, in the muscles. And just to cast a little light on it, the most famous Canadian to have any sort of bone tumor was Terry Fox, okay? And that's the sort of thing that I deal with. I deal with patients who have osteosarcoma and various other types of tumors of the skeletal system. And whereas 35 years ago, the treatment for those patients was rather limited. Patients had amputations and then they died. The treatment now is much, much better, and patients are living and they have their arms, they have their legs, but quite often they do live with chronic pain issues, cancer pain issues or chronic pain issues. Some of the pain is due to the cancer, some of the pain is due to what I do to them, unfortunately. 12-hour, 14-hour operations, and they have, ongoing pain. And in some situations, that pain is not well managed. And so from my perspective, I think medical marijuana is certainly underutilized and somewhat stigmatized amongst the Canadian establishment, the medical establishment. So I have some patients for whom I prescribe medical marijuana. The whole system is fairly complex and circuitous and filled with bureaucracy. Ultimately, they get what they need, but I think that system could be much, much better, and I think this system that you're all here to hear about tonight has the opportunity to improve the lives of Canadians, Canadians who are in various different situations, cancer patients, one who have, maybe at the end of life in palliative situations, but also people who just have chronic pain. And if I were to say to any one of you, you're looking at living the next 50 or 60 or 70 years of your life in pain every day, that's not really a palatable option, okay? And popping narcotics every day, getting addicted, is probably not the best solution. So if there are other alternatives such as this offers, I think that would be a particularly ideal solution. The other thing that I would like to talk a little bit about is the system, the EMR system that you are all looking at here, the CanaCard system, and I've had the opportunity to look at this extensively. I can tell you that most of the EMRs that are out there today, having looked at a bunch of them, are dreadful. It's pathetic, and I'm talking from an academic health point of view. They're awful. They are designed often by physicians who know nothing about how to design a system like that. They're terribly user-unfriendly, and the thing that struck me when I looked at this system, first of all, was how user-friendly it was. I could sit and add a patient, I could book an appointment, I could book a follow-up appointment, I could fill out a prescription, I could order a test, I could record my history. I can tell you right now, I've got a room at my hospital that's filled with paper charts still, and I'm dying to get rid of that system. It's a terrible waste of space, a terrible waste of energy, a terrible waste of resources. And so something like this, I think, really stands to change the way we practice medicine, and I think that sort of the prescribing component of it is one aspect. I think if we're thinking broad reaching, the whole sort of user-friendly EMR system, I think is really a potential huge benefit, a huge win for the medical establishment. So I'm enthusiastic about this relationship that we've developed and hopefully going forward, and I am keen to participate in this endeavor. Thanks very much.
Thank you. Yeah, I just want to personally thank you on behalf of CanaCard and Ultimate Health for being here. Bring your brochures with you because that means we're easy to find. And we'd like to hear more from you. God bless you, ladies and gentlemen. Thank you very much. Until we meet again.
Contact CanaCard for more information or for a live demonstration of the CanaCard Patient Management System.